The transition to a green economy, like all major transitions, comes with trade-offs, often wrenching ones. When economies shift away from fossil fuels to renewable energy sources, the effects reverberate through industry, finance, politics, and societies. And yet, driving these transitions is obviously critical to the task of mitigating the effects of climate change. The global picture, as I'm sure you've heard this morning, since the COP conference has been decidedly mixed. In the United Kingdom, the pressures of inflation, public expenditure, supply chain disruptions from the pandemic, and the war in Ukraine have all coalesced to prompt some people in the Tory party to argue that Boris Johnson should put the brakes on his green agenda. And of course, as no doubt came up earlier today, in the US just yesterday, the Supreme Court ruled that the Environmental Protection Agency does not have the right to limit carbon emissions from power plants, which deals a devastating setback to President Biden's efforts to limit US carbon emissions. Today, we're going to discuss how government, industries, and civil society can help cushion the blow from the transition to a green economy. And I think more importantly, we're going to discuss how in that process you attempt to maintain equity, a sense of justice, so that one part of society or another isn't disproportionately hurt or disrupted by the transition. So with us today to discuss these questions are four terrific panelists who each bring a very different perspective, and hopefully together will constitute a very rich discussion. I'll start down at the very end with Karan Villamoria, who I've actually had the pleasure of sitting on a panel with at COP26. He's the founder of Cobra Beer and the chairman of the Cobra Beer Partnership. He's perhaps best known for his time as the president of the Confederation of British Industry. He's just stepped down from that role, but continues to serve as a vice president of the CBI. Immediately to his right, we have Alexandra Palt. Alexandra is the Chief Corporate Responsibility Officer at L'Oreal and the CEO of, I'm not going to pronounce it in the French way, the L'Oreal Foundation. She's a lawyer by training. She previously worked for Amnesty International and other organizations that specialize in diversity and sustainability. She joined L'Oreal as Chief Sustainability Officer in 2012. Then immediately to her right is Rosamund Adikisi Deborah. Rosamund is she has a couple of different titles. She is the Breathe Life Ambassador and the founder of the Ella Roberta Foundation. This foundation was named after her daughter Ella, who died at the age of 9 in 2013 of asthma. And Ella actually became the first person in the world to have asthma, to have air pollution listed as the cause of death on her death certificate. And so Rosamund is obviously very engaged in issues around air quality and air pollution. And then lastly, immediately to Rosamund's right is Nick Watts, who is the Chief Sustainability Officer for NHS England. That makes him the key driver in NHS's goal of delivering the world's first net zero emissions health service. Previously, Nick worked with a range of health organizations, including the World Health Organization, and he also served as executive director of the Lancet Countdown. So a very interesting and varied lineup. And what I propose to do is simply give each of the speakers a chance to speak very briefly about what they think the key issues to address in this area of trade-off and ensuring equity are from their perspectives. Throw it open for maybe another 20 or 30 minutes of conversation, and then go out to the audience for your questions. So why don't I just start with Karan. In your role as the past president of the CBI, you've obviously thought a lot about the role that business plays in driving this transition. And I know that CBI, among other things, has held a decarbonization conference. So I'd love to hear you just talk a bit about how industry can help make this transition more equitable for everybody.
Thank you very much, and it's a great pleasure being here. Yesterday I was present over here for the launch of the Climate School by Sophie Lambert. Sophie is here. Congratulations to you. That's a great initiative, and a huge round of applause for you. It's at COP26 when we were there. I was there for 1.5 out of the 2 weeks, and the big difference between this COP and COPs before was that business was present in a very big way. And countries had been setting targets. Countries set targets at COP26, but business was also not just present, but setting targets and also saying, how can we actually achieve it? So not just we're going to get there, but how are we going to get there? And the Climate School is one way in which a company can say, we want to get to net zero by 2050. And by the way, 60% of the FTSE 100 have already committed to net zero by 2050. But how many of their employees know, A, what it's about, and B, what their role in is, and what they can do to help their company to achieve it? So there's a huge role in educating people, and the Climate School is going to be doing that, and I'm proud to be an advisor to that fantastic initiative. So at COP26, a lot came to light, and I think that one point was very clear, was transition. This is a transition. This is not an on-off switch, much as many of us in this room would love to just switch over to renewables straight away. We are realistically going to have to live with using fossil fuels side by side as soon as we transition. And I was on the BBC yesterday on this program called The Context, and we discussed this very issue about the American court judgment. Now, America is responsible for 14% of the world's emissions. I mean, it's got to come down. Now, you can't stop them using fossil fuels, but what can we do to accelerate it? And I think this is the difference where business now realizes, in a time of crisis, so many businesses say, hang on, get the businesses to remove these green subsidies. We can't afford them. They've got to help us, and we can park that for now, and we can deal with it later on. Exactly the opposite. We need to double down. We need to double down on this transition with a sense of urgency like never before. Because the sooner we can do that, the less reliable we will be on countries like Russia for their oil and gas. The sooner we do that, the more self-reliant we're going to be. And we can do it in a number of ways. When I joined as vice president of the CBI before I took over as presidency, I chaired the Heat Commission. Now, how many people know that 1/3 of greenhouse gas emissions comes from heat? And half of that comes from buildings. And the 29 million homes in this country, only 1 million of them are up to the standard if we're to achieve net zero by 2050. We have to upgrade the rest of them with insulation, whether it's heat pumps, whether it's community heating, whether it's hydrogen heating. And it was fantastic. We've got a way of doing it. The 250,000 jobs it will create, the innovation that will be driven through it. Hydrogen. Look at the potential of hydrogen. We've got a company, a CBI member in the Northeast, as we speak, that is blending hydrogen into natural gas and heating homes using hydrogen. It is not that far away, maybe less than a decade, when we could have homes heated with green hydrogen. Can you imagine that? Heating with green hydrogen, zero emissions? Wow, it's possible. I can see it. Nuclear, whether you're for nuclear or against nuclear, small modular nuclear reactors. Rolls-Royce have the technology. I'm told very reliably they can be set up within 4 to 5 years, each one of them with the capability of powering a city the size of Sheffield. And finally, if I may say, to your point, government, universities, and business working together is the solution going forward. The Heat Commission was in collaboration with the University of Birmingham, of which I'm proud to be Chancellor. If I give you a very quick example, at COP26, one of the highlights for me was to chair a meeting of transport leaders on board the world's first moving retrofitted hydrogen-powered train, Hydroflex, delivered by the University of Birmingham in partnership with business and in partnership with the government. That's the future, and that's what we've got to strive for.
Thanks, Karan. Rosamund, I'm gonna jump over to you now. As I said before, you approach climate from a very specific perspective, which is that of air pollution. So I'd like you to talk a bit about how that perspective on climate policy can also help with the issue of justice. But also, I'd invite you to speak more broadly, because I have a feeling you have a few opinions about some of the outcomes of COP26, what has and hasn't happened after some of the grand statements in Glasgow. So take it away.
I think talk is cheap. and I think most people see the world through my eyes, actually, because I think most people would accept that even coming here, certain points coming through Charing Cross Station through here, they could smell the air pollution in the air. What I am interested in is about your health. I don't know what everyone else is telling you, and what science has found out, or specifically, um, Dr. Grigg, is that if you live near a busy road, then it is equivalent to smoking, or to passive smoking, sorry, 10 to 15 cigarettes daily. So what I am interested in is people's health. And I'm really glad I'm here. I'm kind of overwhelmed. And thank you so much for coming out, because it's a different audience we're talking. We have found out that some of these solutions on air pollution will also help climate change. But the reason why I want you to care about air pollution is 7.9 million people worldwide die every year. So we're not talking in a year's time or 2 years' time. We're talking now. More and more younger people are becoming ill, brain cancers, so things that used to be in old age. Now we've looked at every organ in the body, even to the point of COVID, that in areas of high air pollution, believe it or not, people got COVID more severely. Now, what we've also found out is we don't all breathe the same air. And people get very uncomfortable when I say the reason why my daughter isn't here is really because of where we actually live. And the sad news to say to you is things haven't changed. They've actually got worse. And everyone can see it. People make these promises. Look, 2050, I'm just thinking about to the end of the year, how many people are going to get ill. Now, I believe what people can do is pressurize the authorities. People went to COP26, governments went there, they made all sorts of promises. And I'm sure Alok Sharma won't mind me saying, because I've met him, guess what they're doing when they went back to their countries? They are all going back on their promises. And the war in Russia, by the way, it's an excuse. If you, if you follow the timeline, they've been making promises forever. The Paris Agreement, they all roll back. Now, from where I'm standing, I keep on thinking, what can you do? The only thing I can do is raise awareness about the impact of air pollution on people's health, and you have to demand. If you don't, nothing's going to change. I'm very saddened about the EPA, because I met Michael Regan recently and he seemed like he really understood the whole thing about climate justice, but can you see there are powers even bigger than him. So I think most people want to breathe clean air. Most people don't like. I can't even contemplate heat pumps. That's something in the future. I'm talking about the here and now and what people can do. You mentioned the Tory government. They put out a consultation recently that closed on Monday. It'll be interesting to see even how many people here knew. It was about setting targets for the next generation to come. If they all thought they might lose their seats if they didn't take it seriously, I bet you they would suddenly take it seriously. So I think what people need to be aware about is the impact of air pollution on people's health. And I said to Nick, I took my daughter to hospital on, I think last week. I was just amazed when we got in there. It was like carnage. Seriously. And I thought, oh my God, all these people are ill. There was like cancers, all sorts. I just couldn't believe it. So my plea to people is about the air which you breathe. It is suppressing everybody's immune system. And Camden Council have come up with something really exciting, which I'm hoping it's going to take off. They found sensors that they can put in the borough, and people locally can download the information onto their phones, and they can see the air they are breathing in. And I'm really hoping this is going to take off, i.e. this isn't some gimmick, because I think the more people pressurize, so I'm not talking 2050, I'm not talking even 2030, I'm talking now. And do you know why? The most vulnerable are your children, like my children. They are most vulnerable because when they breathe in this air, it is damaging their lungs. But if you clean up the air, lots of it will also help the climate. But the climate is so huge, I just need to deal with air pollution. And think, every single year, 7.9 million. If we do nothing, that figure is going to go up. And air pollution, guess what? Trust me, it is out there. You may not see it with the naked eye, and that is part of the problem. So my goal going forward is raising awareness. People need to know the impact that air pollution is having on them now, not in 2050. Can you imagine every year 8 million people dying? I don't know how many years. How many years is to 2050? That's 20. Yeah. Can you see the amount of people we actually would have lost? Look at the floods. Look at all the things. But politicians, by the way, are the key. I work with people like Nick and the National Health Service. Chris Whitty is coming on board. And why is this serious? This year, he is writing an actual report about air pollution. So the CMO is that worried about the impact air pollution is having on the nation's health. So look out for it in September. But please pressurize the mayors, your local councils, and the government. Yes, we can do our bit, but as I am learning, we can only do so much. A lot of the decisions are from government and those high up. Thank you.
Thanks, everyone. I'm going to go to Alexandra next. Alexandra, you have a background both at Amnesty and in the cosmetics industry, and you've grappled with how climate policy and climate change can actually be a threat to the rights of women. I'd like to hear you talk a bit about how that manifests itself. If you have some examples from L'Oreal's supply chain, that would be great. And I'd love to hear you tell us what you think industry can do to mitigate those effects.
Okay, good afternoon to all of you. So first I would like to say, the first question you asked, and I'm coming back to that, is trade-offs and equity. Yeah. And actually, these are two very different issues. Huh?
Okay.
Very, very different. Because the trade-offs, that is like, how much money do we put into transformation and transition, and where do we get it from? And that is honestly, there are a lot of numbers out there which are part for me of barriers and obstacles to put there, because when you are doing it and when you sit down and calculate every year what costs our transformation of our business model, actually we find the money. It's a question of political will. Equity is about something very different. It's not a trade-off. Equity is a condition for that climate policies and climate action will succeed. Because I think what is very important is that people are not going to care about climate change as long as they do not eat, they do not have housing, they do not have education, because climate change still seems to be a little bit far away, which is, of course, as you said, there are 8 million people who die because of air pollution. There are also people who start to die because of climate change, heat waves in India, everywhere in the world. So there is a huge issue which is related to, if we want a lot of countries who now, you go to a lot of countries and you ask people, is climate change on the top of your agenda? The people will tell you no. And we can understand that, because they do not eat, they do not have electricity to study, they do not have housing, they cannot educate their children in a correct way. And part of this is, well, we have a responsibility in this, and we have a responsibility in this as Western countries to transform this, as rich countries and as rich companies. And so there are many examples that I could give you. We see that women are disproportionately impacted by climate change. They are going in food supply, water, as caregivers, and caretakers. So there are many issues where women are going to be disproportionately impacted. They are not at the negotiation table. They are not listened to. They do not design climate policies. So this is a problem. So governance has to change. Everything has to change in order to take more into account women. And then there is also the issue of what, as a company, we see already. So what we see is that when we source our raw materials, women producers are already impacted. Well, everybody who is working in agriculture in countries around the world is impacted by climate change. So what we try to do is we work with our suppliers and always on-the-ground organizations in order to help to adapt agricultural practices, to go to low-carbon practices, to get out of pesticides, to develop co-cropping, so to have more revenue, but also better sustainable practices. There are a lot of different examples that I can give you, and if you are interested, please don't hesitate to ask me afterwards. But I think my number one issue is living wage. Living wage throughout the supply chain. And that means living wage is not minimum wage. It is living wage is the wage you need to lead a decent life. And a decent life means that you can feed, educate, house, take care of the health of yourself and your dependents. And that is established in every country. So what we are doing at L'Oréal, and luckily we are not the only company speaking like that. We have done it for all our employees, but now it's how are we make it happen in our supply chain for our suppliers. Because living wage is a condition and not a trade-off for the transition or the transformation we all need together. People have to be able to live correctly so that they can care about 10, 20 years future. And so I think what we all have to do now on the social and equity side is to fight for a living wage.
Thank you very much, Alexandra. And then finally, Nick, we've all been thinking and talking so much about the NHS over the last couple of years of COVID, but I don't instantly think of the NHS in the context of climate change, and maybe I should, and in fact, Rosamund was beginning to tell me why I should. I guess I'd be interested in hearing from you how you see the role of climate policy and healthcare linking, and if you would also address that issue of equity in healthcare.
Of course. So, the NHS, 1.4 million healthcare professionals, fifth largest organization in the world, biggest organization of health professionals anywhere. We've existed for quite a while, to deliver high quality care for all, now and for future generations, okay? High quality care for all, now and for future generations. And on that premise, I kind of want to challenge, or reframe maybe, the way we're thinking about this. Number one, climate change is the biggest global health threat of the 21st century. The NHS, we are full of good healthcare professionals. We know this is a fact. We also know that it is the biggest health equity challenge of the 21st century. If you don't act on climate change, that is how I can guarantee you will worsen health equity, worsen health justice across the world. I can promise you 90% of the health impacts of climate change are felt by kids under the age of 5. So what are you going to do about it? And I've got a second reason why I might want to challenge the premise of this, because I am more worried about inaction than I am worried about action going in the wrong direction. What does it mean for the NHS to say something big, bold, easy to say net zero by 2045? Watch me say it again. Easy, much harder to say, what do you mean by 9 a.m. tomorrow morning? What do you mean for an organization of 1.4 million healthcare professionals? I'll give you 3 quick examples, and then I'll wrap up. Number one, it means investing heavily into our hospitals, into our primary care facilities. How much? For the NHS, £611 million just in the last 18 months. Why are we investing in low-carbon healthcare? We're investing because it saves money for the NHS, because our patients love it, because it makes the NHS more efficient. We are innovating. 5 seconds ago, there was no such thing as a zero-emission ambulance, nowhere in the world. There are 2 now. One of them, fully electric, up in Birmingham, carrying patients at the moment. They love it. It is you wouldn't believe the difference moving in an electric vehicle while you're in an ambulance rather than a diesel thing with that motor in the back. Those sorts of innovations are important because they save the NHS money, they allow us to reinvest in care, but they also tackle directly the health equity crisis that we see from air pollution, the 36,000 deaths in this country alone every single year from air pollution. The second thing, you have to shift the things you buy, the things that we prescribe as doctors, as healthcare professionals. And so we have new schemes out across the country investing heavily, £26 million in our asthma nurses, in our primary care professionals across the country, having intimate, direct conversations with their patients about their respiratory health, about their cardiovascular health, and about how we can make really simple, really small shifts to actually improve patient care, but also tackle climate change. Fair enough, and then we can do that. Is that easier? It's always dangerous to give an Australian a microphone. Yes. The third thing, I was just out at Frimley Health just this morning, seeing some of the cool stuff they're doing out there, starting to think differently about what it means to be a GP, starting to think differently about what it means to deliver high-quality care for your patient. When someone comes in and they've got a pneumonia, but they've had a pneumonia again and again and again over the winter, and they've been in and they've had quite a few admissions, just some antibiotics and a flu vaccine, that'll certainly deal with them in the short term, right? Medical school can tell me that. If you start to actually look past that and go, why is this person sick? And you start to, as they are across the country, engage in a bit of social prescribing, a bit of personalized care, you might start to, as we are seeing from our GP practices, prescribe more efficient boilers, prescribe electric heating, prescribe insulation, prescribe better housing, and allow the NHS to deliver that funding out to patients as well. You will see it will drastically reduce the number of people walking through the emergency department because you have a much healthier population. Those are the three things that it means to me right now for the NHS to take this on. The core point, though, is each of those, whether we are investing in care across the country, whether we are tackling air pollution directly, or whether we are engaging in the root causes of inequality, the root causes of poor health. All of those things are the perfect example today of how tackling climate change directly can tackle that health inequality challenge as well.
Thank you, Nick. Well, four very strong perspectives, not necessarily at odds with one another, but each very different. And so I think what might make sense at this point, rather than going on in this format, is just to throw it open to questions. We have about 12 to 15 minutes, and I think in all of these presentations, there must be a few things that were provocative or raise questions with you guys. So that's my proposition, to just go ahead and invite people to ask questions. And if you could do me a favor, identify yourself before you ask the question, just so we know where you're coming from. And there's a lady in about the fourth row right there with her hand up. Why don't we start? And there's a microphone coming around as well. Go ahead.
Hi there, Diana Carrion. I'm the founder and CEO of a social enterprise called Today Do This. And I have a question specifically for Nick. I'm wondering what the mechanisms are that you are using to get different kinds of employees from across the NHS to take action in the specific ways that you described in order to tackle climate change and health.
Hearts, minds, a bit of inspiration, a bit of fun, right? Usually the team that is winning is the team that is having the most fun as you go about it. And so for the NHS, this means a few things. Number one, we got to get some boring governance things right, okay? There is no longer one net zero strategy in the country. Every single hospital in the country now has a board level lead and has a board approved net zero plan, personalized, localized, developed with patients, developed with staff, giving permission, Royal Cornwall Trust, with the responsibility to tackle climate change in the job descriptions of every single one of their staff. In fact, today, we don't talk about it very much, but the Health and Care Act of 2022 comes into force today, came into force at 9 a.m. this morning. The first piece of legislation in the entire world to directly address the health profession's response to climate change. On the face of the bill, new powers, new duties across the entirety of the NHS to take this on directly. So you get the governance stuff right? But then you have to think really seriously about providing the capability, right? Making sure that people have the training, that people know how to engage with some of these challenges. And so we are developing new courses out across the system for people to think seriously about, okay, well, what does it mean if I am an endocrinologist for me to net zero my health service? What does it mean if I'm a nephrologist? What if I'm a community nurse? And so we have those sorts of pieces out there. And then you have to provide a little bit of funding. Right.
Can I just come in very quickly?
Yep.
You know, you think broadly about this. I'm a patron of something called culinary medicine. Do you know how many weeks, months that a doctor in their 5 years of training spends on nutrition and diet? 1 day. 1 day in 5 years. And what we're doing is taking doctors into the kitchen for a week and making them aware of this so that when they prescribe medicines, it's not just, here are the tablets or here's what you need. What's your diet? How can you change your diet that'll make you healthier? I tell you how many lives we'll save just by getting doctors more educated on that.
Yeah, could I just quickly add on to that the legacy of my daughter's inquest, the coroner has insisted that everyone in health needs to educate themselves about air pollution and the impacts, because one of the things we found out is in the National Health Service at that time, doctors who should have known about these things didn't know about it. So that is that is one thing they can do, that everybody in health, it doesn't matter whether you're a surgeon, and they have all, by the way, they have all agreed to it. One thing I just quickly want to say, because I know time is not on our side, we all live somewhere and we all have local councils. Could I kindly ask the audience that you demand where you live that air pollution is monitored, and therefore you know what you are breathing. It is a very small ask, but it will make a significant change. So right now we've got people in health being educated, we've got the public demanding more monitoring, and we will continue to pressurize the government. So if you did all these three things, a significant change would actually happen.
Great. Let me do this, if you don't mind. I want to ask for a couple of questions, just so we can get a couple of questions out there, and so we have the maximum number of people heard. There's a woman here in the second row, and is there this gentleman over here by the pillar? Why don't we start with you, and then we'll get a question from you.
Dangerous giving another Australian the microphone. My name's Sophia Hamblin-Wong. I'm the COO of a company called MCI Carbon, and we're a negative emissions technology based out of Australia. I'm going to ask two questions to each half, if that's okay. One of them is just providing perspective from Australia in the bushfires that we had just 2 years ago. We, for the first time ever, considered the impact of bushfire smoke on our schools, right? Children were going to school every day and breathing in smoke, and we had no air purifiers. We had a shortage of HEPA filters and things like that. There are all kinds of unknown, unintended consequences of on our health for climate change that we just don't know about. And so do you know of any anticipation or future thinking in this space where we're war gaming what could happen in the future? So that's a question about health. And the second question relates to the work that I do, which is in decarbonising heavy industry in Australia and around the world. We're trying to create jobs in the just transition, particularly thinking about what are coal miners going to do in the future? What are the people who have mortgages and good, and livelihoods to keep going in our economies? What sort of jobs are they going to have? How do we create those jobs? And so my question is, how do we ensure that the just transition brings the community along for the ride? How do we keep them a part of the conversation?
Hold that thought for a second, and this gentleman will get your question, and then we'll take those two together.
Question.
Hi, Michael. So I'm a student from Imperial College, London. I'm currently studying climate change management and finance. I'm also working with the Imperial College NHS Trust. So I'm currently working at the SIAM program as well as the Community Diagnostic Centre program. It's towards you, Nick. But to be honest, like a lot of the situation I'm currently facing, as in from this working a short period in this program, is that I'm finding it from the upper management, as in from your level, you have a fundamental grasp of sustainability. However, if you look into the detail, the roots of individual hospitals, the recognizing that sustainability is not high. The procurement process at the moment only accounts for 10%, and that's a combination of social as well as environmental. So how can you encourage this to actually implement change? Because at the moment I'm finding it difficult to see how the green plan works. Sorry.
Okay. Why don't we do bushfires first, and then what do you do with all these idle coal mine workers, and then we'll do the NHS question. Who wants to do bushfires?
It was more about jobs for us, I think.
It's more about jobs for you guys.
I have the impression.
Yeah,
It's about green jobs. for you.
Rosamund, do you want to talk quickly?
Yeah, about health. I think it is educating people about the impacts of health. By the way, I was just at a meeting. I'm not sure whether you were there. I've completely forgotten the one recently. Sorry, I apologize. But I think people in health realize that we need to also talk about indoor air quality. One of the things I would say to you is ventilation. By the way, it is not one for trying, by the way. There are people there who put pressure on governments about ventilation in public buildings. And I think Germany is far forward than we are. So we are aware that indoor air quality is not just the outside, it is also what goes on in the inside. But again, being a teacher, I'm going to say education. But by the way, governments do know about it. And there's always excuses, but by the way, this is what I have found. And that's why my actual ask in general was people need to start pressurizing, because the solutions are actually there, by the way. People know what these solutions are. And Nick and I will both agree, they are very slow, aren't they? They are incredibly slow. I am forever frustrated. Sometimes I sound pessimistic. It's not that. It's just the children, like you say, it is a cause for concern of the future. But they do know, trust me, they know as much as I do. So you need to ask yourself the questions, why aren't they doing it? It's not that they don't know. A lot of it is about fossil fuels, and we all know what fossil fuels is about.
Alexandra, do you want to... Alexandra, do you want to tackle the jobs question?
But well, now because it would be, it would be a very general answer that you can read in the newspaper. So I would like to build a little bit on that and say my favorite issue in the climate crisis is the issue of leadership. And when you're a leader, you have to evaluate risks and you have to anticipate. And our system is not favoring a leadership that takes into account risks that are 10, 15, 20 years. Our system is encouraging leadership that thinks about 2 years, 3 years, to get re-elected, to get your bonus in companies, and that is not going to be sufficient. So what is now, as we are starting to feel the consequences of climate change and other problems, so people start to do risk evaluation, and that we do that in companies, and states and countries do that also, of course. But the problem is that we have to manage complexity, and complexity as a leader, you have to have a kind of vision and values, and you have to know where you want to go. And in the moment, complexity is managed in the short-term period of thinking, and that is not going to be sufficient, neither on the transition on jobs, neither on health, neither on climate change, on nothing. So once again, everything comes to what are the kind of leaders and the kind of collaboration we all vote for, favor, because this is going to be the condition for anything else. So I would let you the job question.
Well, if I may just very quickly, on the equity part of it, I don't want to lose this. I said at the beginning, America is 14% of emissions and 4% of the world's population. That's not equitable to me, at all. So it's got to come down. Second thing, Rosamund, we're very happy to hear the Oxford University Healthy Cities Commission is reporting on the 13th of July.
I'll look out for it.
And a great part of it is air pollution, and you're spot on, and all that goes with being healthy living in a city. And when it comes to the transition and jobs, here's the reality. We've had transition. Look at the transition with the internet over the last 25 years. People thought, oh my God, it's going to disintermediate lots of people. Well, actually, we've got the lowest level of unemployment at the moment, in going back in decades. People, we have to adjust, and the key to it is reskilling. At the CBI, 9 out of 10 of us will have to reskill in the next 10 years. Companies are going to have to spend £130 billion to invest in training and skilling. And here's the worst thing. The government says, oh, lifelong learning account. It's not going to come into effect till 2024, 2025. What are we waiting for? We need lifelong learning right now, available to everyone of any age in this country, because the learning never stops. As I said yesterday, Mahatma Gandhi, one of my favorite sayings is, live as if you're going to die tomorrow, learn as if you're going to live forever. And so crises can be temporary. All the crises we're going through at the moment are a nightmare. But climate change is permanent. So we've got to reskill. Nick,
do you want to answer the...
Sure, it's a good question. You clearly know what you're talking about because you've read some of our sustainable supplier roadmap. You know about the 10% weighting we've introduced into every single tender from April 1st, so you're up to date. Good. I'm going to reframe your question if you don't mind. How on earth do you unlock the full potential of 1.4 million healthcare professionals, not just the chief executive of Imperial College Healthcare Trust, excellent though they are? How's that? I talked about it a little bit. You get governance right. Autonomy matters. Making sure that people know that this is their responsibility and they are allowed to do it. You do that with things like the Health and Care Act of 2022, with those green plans, a little boring, though they can occasionally be. You make sure you have a board-level lead at Imperial, and there is one. She's excellent. Number two, capability, capacity matters. And I talked a little bit about the training that you need to provide to our healthcare professionals across the country. You also need to make sure that they have the time, that they have the resources. And so you're going to hear from us in a couple of days, I'm sorry, Zuleika, £15,000 grants out to the system. If you are a nurse in the system that has a cool idea about how you could improve care and also tackle climate change, then we want to hear about it. The conditions are, it has to do those two things. You have to learn something, and you have to have fun. So you get your autonomy right, you get your capability and your capacity right. Third thing, relatedness matters, right? For any powerful change agent, you have to have friends, you have to have connections across the country. And so to that end, the NHS is working with the World Health Organization, working with healthcare systems across the entire world to say, listen, just because we were the world's first healthcare system to make a commitment like this, we don't have to be the last. The response from 17 other healthcare systems, national health systems in the world was, yeah, okay, bring it on. Spain, Belgium, a new ministry in Germany, a new department in the Federal Ministry of Health tackling the climate crisis. In France, the Ministry of Health and Social Affairs hiring 72 people to take this issue on. The HHS over in the United States, God, even in Australia, coal capital of the world, even in Australia, 5 of the 7 state departments of health starting to take this on. If you get your autonomy right, if you get the capability and capacity right, and you get the relatedness right, that is how you unlock the energy of a 1.4 million person strong healthcare workforce.
All right, listen, that's the most razzle-dazzle I've ever heard from the NHS in my life.
I'll report that back to Sajid John.
I'd love to take more questions. Sadly, we're out of time. In fact, we're over time. So
Could I just say one line?
You can.
Please
Rosemary.
treat the climate crisis as a public health crisis. Yeah. Full stop. That's it.
Yeah.
All right. Well, look, on that very pertinent note, I just want to thank the 4 panelists. I actually think this was terrific. It had one of those classic think tanky titles, and we wound up having a really interesting conversation. So thank you for smart questions. Thank you for the panelists, and thank you all.
You.
Yeah.
Thank you.
All right.